So the first hot topic that I want to talk about is fluoride, and this is something that our practice was kind of founded on, eliminating fluoride as it is a commonly used material in conventional dentistry. So fluoride has topical effects on our enamel. So when topically applied to our enamel, fluoride can actually change the chemistry or the makeup of that enamel and actually make it more impervious to demineralization or decay development. And so when this was first discovered, this was really a breakthrough in public health and dentistry and helping to curb the rates of dental decay. Um, and that was great and all until we started to understand what fluoride actually is and how it impacts not just our enamel but other parts of our body. Also understanding why dental caries or decay develops. And again, as opposed to just treating the dental decay, understanding how to prevent it. And so things have evolved over the past 50 years since the introduction of fluoride. And what we now understand is that the disease process of dental decay is a lot more complex. And fluoride is something that, when topically applied, will strengthen the enamel. However, we now have other options that we can use that are safer, such as hydroxyapatite, calcium, and phosphorus as well. And also, again, treating the reason why the decay developed in the first place, which is really complex. It can involve things from diet to airway and obviously hygiene. So it's oftentimes a very difficult thing for many dentists to really sit down and try to piece through because we just don't have the time to do it. But as a biologic dentist, that is my goal. Again, fluoride is something that, when introduced in the rest of our body, can start to create deposits in certain areas like the pineal gland that can alter its function. And again, fluoride's action is when it's topically applied to the teeth, not when it's ingested. And in fact, when there's overconsumption of fluoride as we ingest it, that can actually cause something that's called fluorosis of the enamel, which basically can model or change the context of the enamel and actually make it more weak. So when we talk about fluoridated water, we have to be very careful because sure, it is passing through our mouth and touching the teeth for a brief moment, but then we're ingesting it, which is not really the action of fluoride. Topically placed fluoride might have a better application. And however, like I said, we now have alternatives that are a little bit safer. For instance, hydroxyapatite, several studies are showing its efficacy, and hydroxyapatite is what our teeth are made of. And so it's a safer product that we are now using instead of fluoride. And I'm hopeful that that will help curb some of the disease rates. But again, I'm also looking at things like diet and hygiene and airway and lots of other, microbiome, salivary content, things like that. So, so again, probably one of the most controversial topics that gets brought up in our dental office. And it has a place for sure, but in our office we don't use it, and we look for alternative options.